I'm Miranda Materi.
And I'm Shannon Scalvo, and we are Hand Therapy Academy.
Hi, Shannon. Welcome to your first podcast with Hand Therapy Academy.
Thank you.
We're doing a little different. We're starting a mentorship series, and this is where we're asking some of our therapists that work for us, where they can ask us anything, ask us questions, things they're dying to know. And our first one is Shannon. Shannon, why don't you tell us a little bit about yourself?
So I am the most recent hire. I just graduated from Northern Arizona University just back in May, and I actually just passed my boards like 2 weeks ago. So the newest of new grads that you could get. And I am looking to get my CHT one day. So working at your clinic in the hand therapy setting.
Well, congratulations on passing your boards. I know we're really looking forward to having you on as a full-fledged therapist. Why don't you tell us why you're interested in hand therapy and uh, those things, and then we'll get into you asking me the questions.
It's funny because I wasn't, as you know, interested in hand therapy at all. I actually really didn't want to go into it, but I ended up, because of that, ended up being placed in a hand therapy rotation. And I think the real reason, like, why I love it so much is because it feels like it's always a puzzle and there's always something new to learn. And so, in that sense, like, I could never get bored. And I love learning. So.
Yeah, I do feel like it's a great setting if you love learning, because you're always going to be learning for
Mm-hmm.
sure, even 20 years later. All right, why don't you go ahead and ask me your first question?
Okay. My first question is, what books have made the most significant impact on your career?
Oh my gosh. Okay. There are a couple that I think are staples, and this is in terms of hand therapy. And there's also some that are non-hand therapy related that I'll share with you as well. And I think they are probably books that I have given you, because I usually give them to students as well. But I'll share with everyone. One is Rehab of the Hand. And when I first started, it was like a yellow color. And I remember I asked my parents to give me that book for Christmas, and I got the book for Christmas. And it was like the best gift ever. So I think that's a big one. And I still use it to this day often. So it probably never goes a week where I don't like crack it open, at least to look for something. So I think that's a great resource. It is very overwhelming, I think, as a new grad and as a student. So I do understand that. And I wouldn't say like go read chat. I mean, do what's best for your learning style, of course. But I think just looking up answers in there that you're looking for is very helpful. I think if you try to read it chapter for chapter when you're first starting, it could be a little overwhelming. And then next, I love the Purple book. And that is, I think, a really great book for quizzing yourself and asking questions. I like the older Purple books better because I feel like they're a little smaller and more condensed. The new one is so heavy with a lot of information. I think that too can be overwhelming. So I think as um, a new grad, I would probably even just try to find an older one. And I don't think they've added a lot of new content. So I think if you're studying for the CHT, yes, you can get that one later, but start with the smaller one. And then one book that I think was really powerful for me that's non-hand therapy related is The Magic of Thinking Big. And I just love that book. And it makes you think that, or just like reading people's stories, just because it's been done before doesn't mean you can't do it again and do it better or in a different way. So I think I was really nervous about starting a hand therapy practice. But after reading that and exploring that, it was basically saying, it's okay if there's a lot of competition in the market, because that's what a lot of my peers were telling me, and people who I looked up to and mentored me were telling me the market's pretty saturated. They weren't sure if it was a good idea. But reading that, I was like, no, I think I can do it. I think I can do it, and I can do it in a different way that makes our service a little different from everybody else's. So that book was very influential for starting out.
My next question. So I feel like in the clinic, like, there's certain things that are kind of like the meat and potatoes of hand therapy, and one of them is like anything involving tendons, right? Tendinitis, tendinosis, tendinopathies in general. But like from my understanding, like like the research on like how beneficial therapy is for that isn't the best. And so I think I find myself, since we like see it so much, is like I don't necessarily believe in the therapy we're doing. Um, so and like you kind of need to, right, for like patient buy-in, and just like what are we really doing here sometimes. So I was just wondering like how you would navigate tendon stuff,
I
like
think,
specifically
yeah,
tendinopathies.
I think that's a great question. And I think when we think about research that's available, we're always thinking like, okay, there's like this quantitative, we always look at quantitative data, right? We're thinking, and we're not always looking at qualitative data either. And I think there's not, I think that's where we lack, like maybe some of our interventions, the data and the research needs to be driven from a qualitative aspect, because I think, um, the patient may continue to still have tendinitis, but we may have significantly changed some of the tasks that they were able to do. Like, did we modify their desks? Like, say if it was a lateral epi or something like that, do we modify their desk station? Are they able to do their job now? And those things you wouldn't pick up with a quantitative research method, right? Unless, you wouldn't have enough thought. I think it would be difficult to study that, is what I'm getting at. So I think you may not see these differences that you're maybe wanting to see based on the objective measures that we document in WebPT or we document for insurance purposes. But I do think that we can have a significant impact. And maybe it's not that, we're seeing them 3 times a week for 6 weeks. We may be seeing them 3 or 4 times a week, or maybe not 3 or 4 times a week, 3 or 4 times. And then that's their treatment. Then we have them come back in a few months and see if any of those interventions have made a difference. So I do agree with you. Sometimes doing the manual stuff and all that stuff can feel repetitive and not like it's making a difference. But I think there's other ways that we make a difference. And a lot of it is, activity modification, joint protection, teaching them daily exercises. And there's obviously a psychosocial component that I think we as OTs are very good at addressing. So I guess as a new grad, I would encourage everyone, or even older therapists that may be thinking that way. I think we have to broaden the way we think about it, and know that we do make a difference in
Right.
those ways.
I think that's a good point, because like I always am like it, because I think it's one of those things you see them week after week, and it's like really the education and like stuff you're giving them now is going to be impactful a way longer down the line, right? Probably at the point where you're not seeing them anymore, and that's where it starts to feel like a little hopeless.
It definitely does. And for those patients, like I don't tend to like keep seeing them, like this,
Right.
like it's more like I'm teaching them what to do. And if I'm doing a good job teaching, I'm giving them the skills to hopefully, one, get a little bit better, and B, preventing it from occurring again. Right. Because
Right.
then I'm going to start talking about strengthening their periscapular muscles. I'm talking about unloading those tissues.
Mm-hmm.
So I think some of those things are really hard to measure, and that's what our research is lacking in.
Right.
So,
My next question is, what is your least favorite question to get asked by patients?
oh gosh, that is a hard one. I, it probably depends on the
Like
day.
personally, as a new grad, my one of my least favorite questions is like, when do you think I'll be better? Like, when is this, like, can you just, and a lot of times they'll want like an exact, like this many weeks, this many, and sometimes I feel like if you say something like that, they'll hold on to it, whereas like everybody's different. And like of course you can navigate that like using research and like here's what like we typically know from this, but like every person's different. Like I feel like that, especially as a new grad, you don't always know like the timelines, and that's, so personally that's my least favorite question.
Yeah, I could definitely see from a new grad's perspective. And I think you answered, just those things you're telling me, like everybody's different. This is what the research says. And then sometimes I say, I don't know, right? Like it's okay to not know. And I say, I don't know. I'll ask my peers, I'll ask someone. And I do that all the time. I'm going to ask Josh and see what he thinks, or I'm going to look it up and see what that, if there's any new research on it. And I think patients understand that, and I think they appreciate you being vulnerable to say I don't know, instead of just
Right.
saying I think. And sometimes we don't know, right? Like we don't have crystal balls, we don't know this, sometimes those things. So, and they say, and I always tell them, well, we'll know when you stop making changes, or maybe you're 95% better. Like there's different benchmarks for everyone when we decide that we're done with the therapeutic relationship.
Right.
Yeah. Those were great questions. Okay, I think that wraps up our time. Shannon, thank you so much for jumping on with us today. It was great having you, and I look forward to having you back.
Can't wait to be back.
Yeah. So for more information, check us out at handtherapyacademy.com. That's the Instagram handle, or www.handtherapyacademy, or email info@handtherapyacademy.